we go. Hello, ladies and gentlemen. Thank you very much for joining me today on this uh, live podcast on natural dental care without a dentist. So I'll say that it's not my profession to be a natural dentist, but I am somebody who doesn't go to a dentist and didn't send my child to a dentist. And I learned a lot of hard lessons not going to the dentist. And I had to make many changes to my diet and my daily routine to get my teeth under control and prevent decay, prevent cavities, and prevent infection. Now, I have treated gingivitis, so I do treat inflammatory gum conditions, and that's because the gums are muscles. And many of my clients have an inflammatory muscle condition like fibromyalgia or even inflammatory joint conditions like arthritis. And in those cases, we'll often see that the gums, which are basically muscles holding the teeth in place, are also inflamed. So I do treat this type of inflammatory gum condition, and I do have some products that I've used for this condition. But besides that, it's not my profession to treat your teeth. I'm not a professional dentist. I'm sure there's better natural dentists than me. So I just wanted to preface that this is not my profession. But I do think I have a lot of valuable information, and I think I have gotten very good at taking care of my own teeth and preventing dental problems over the last 40 years. Unfortunately, the first 20 years was trial and error. But thank God I still have most of my teeth. And now I have learned a lot to keep my teeth healthy for the rest of my life. So we're going to cover one, nutrition, which is really the prevention, and two, daily oral habits that you can do on a daily basis or a weekly basis to have healthy, strong gums and teeth. And obviously, the goal would be to prevent having to go to the dentist. And then we'll talk about some home remedies and two products that I do sell on remedies.com. Our sponsor who provided me this nice cup, remedies. And then we will maybe answer some questions, and then I'll better explain some of the experiences that I had and mistakes that I made in dental care. All right, let's start here. So first, we want to talk about nutrition. And basically, Ayurveda and Weston A. Price pretty much say the same thing. Unfortunately, Weston A. Price in I think it was in the 1920s, he traveled around the world. He was a famous dentist, and he looked at people's teeth. I'll encourage everybody to go read his books. There's the Weston A. Price associations that exist, and they have meetings and everything, and all around the country. And he went around the world and he looked at everybody's teeth and tried to see who had the best teeth. And then he tried to figure out what they were eating. So you have to read the book for the details. But basically, it's a high-fat diet. Particularly, he found animal protein like milk and cheese and butter in particular. But his big focus was on milk. And you'll have to go read the book. Like the people in Kenya who are drinking a lot of milk, apparently milk blood too. The Maasai, they had great teeth. Some of these people in countries where they're eating like seal up in the North Pole, they apparently had good teeth. And of course, once you came to a Western country and started having processed foods and a lot of sugar, you had a much higher probability of tooth decay. So that was the conclusions of his study. But Ayurveda basically supports the same belief that it's this animal protein. We now know, of course, that milk, cheese, and butter is high not only in calcium and minerals, but vitamin D, which of course is essential for having strong bones or developing cancer. But I sure wouldn't be taking large doses of vitamin D, because you can have excess cancer. And I've known people, I've heard of patients who took too much vitamin D, and that's a very serious health problem. And of course, too little vitamin D is another health problem. And I would not take synthetic D as well. I've spoke about that in previous podcasts and webinars about not taking synthetic vitamins and taking natural vitamins and natural D. So there are natural sources of D3. So, and that was one of the mistakes that I made in my 20s. I was not having dairy before the word vegan was invented. I don't think the word vegan was around when I was young in the 70s. There was the word vegetarian. We were vegetarians at the time. We weren't vegans because they haven't invented that yet. But I was not doing much dairy. And it was only like 10 years later when I started having and consuming milk in particular, and then ghee based on Ayurveda, and then milk because milk is recommended for my body type, Pitta. And only then did I stop having cracking teeth problems, and teeth pain. So there's no doubt increasing the milk for me put a break within a few months to even existing tooth problems. And I can remember having these inflamed teeth and cavities, and I was working diligently to keep the infection at bay, which I think I became a master of avoiding tooth infections. But unfortunately, the teeth themselves were decaying and cracking and getting cavities. It was just that I was very good at avoiding the infections, which I'm going to show you now. Probably the best thing you could ever do to avoid infections is ozone machine. That's right. Ozone. I had to unplug mine from the wall to bring it to you. It's not all set up, but ozone water in a water pick, this is very effective. And then ozone oil, brushing your teeth with ozone oil, and just putting the ozone straight on the infection or the hole, is the cavity, is extremely effective. I mean, it will stop the pain of even the worst cavity in like just a few minutes. So, in fact, I remember years ago being in India, and I was getting a tooth problem because I used to get these occasional tooth pain and from little cracks and little cavities, which I wasn't going to the dentist and filling, and I would just ozone it. But I was in India, and I remember having to go and find an ozone machine in India and paid top dollar for it. Now in India, they use them to wash the vegetables to get rid of the pesticides. They didn't really talk about them using them orally. But anyway, I found one, went back home, plugged it in, put it on my tooth, and oh my God, I finally got my relief. And now, of course, I would never live without an ozone machine. And ozone, of course, is useful for many, many other treatments as well. Ozone therapy is a whole treatment in its own, but I've mostly only used it for my teeth. And I haven't used it for a while. I think it's been probably over a year. Like I said, I haven't probably used that for a year or two. I should. I think I'm going to go after this, my own talk. I've motivated myself to go make some ozone water and ozone my teeth. Now, so nutrition is very good. Things that are very important. A lot of things that any nutritional deficiencies, low in calcium, low in D. Oh, there's my horse. That's why I'm here, hoping my horse walks by for your viewing enjoyment. There he is, posing for us. And And so, nutrition is critical. Fasting, skipping meals, living off of smoothies, having a lot of coffee, acidic foods. These are all going to lead to nutritional deficiencies over time. And unfortunately, our Western society seems to be obsessed with, fasting and not eating and depleting themselves. The amount of depleted patients that I see on a daily basis is at least equal, if not more, than the amount of overweight and obese people. Now, that would be hard for you to imagine, but that's because most people don't know what a depleted person is. A depleted person is thin, bony. Their bones are sticking out. They got holes in their collarbone. They got bones on the back of their hands sticking out. You can see their veins. See, we don't see any bones sticking out nice and smooth on the back of the hand there. The cheekbones are sticking out. Rib cage is showing, which of course many people think is a sign of good health. I think they call it a six-pack or something. But these are all states of depletion. A lot of people are doing radical diets, no fat, no dairy. And you can live without animal protein or meat, but I wouldn't live without the dairy. I mean, the Indians, there's 300 million vegetarians in India, the longest and most well-known and largest society of vegetarians in the world, and they're having ghee and milk every day and paneer. And they worship the cow because without the cow, they will start to have nutritional problems really fast being a vegetarian. So these are common causes of degenerative bone conditions. Your teeth are basically bones made of minerals. So I meet people or women who are postmenopausal. They're already worried about their bone density. They're worried about breaking, ribs or, breaking bones and having bone fractures after menopause. And maybe they've even been into the doctor and the doctor has said you have low bone density. And there they are, still doing no dairy, no milk, maybe out of moral reasons, which, I accept. I love animals, as you can see. I have kittens surrounding me, a horse behind me, and I'm on a ranch with many animals. So I love animals. But it's not the best for your health, particularly if you're a thin vata type of person, and particularly if you're postmenopausal, and where you could be more susceptible to degenerative bone conditions. You want to have a nutritious diet, not be skipping meals, having smoothies, just drinking coffee and having no dairy, because your teeth are bones. So if you're already concerned, if you've already had bone fractures, you've had other signs of joint issues like arthritis, or definitely if the doctor has said that you have low bone density, then your teeth are very susceptible to having problems, and probably already are. Most of my clients who already come to me with osteoarthritis and low bone density, they already have had a long history of tooth problems and cracking teeth and cavities. They're already there. You're just not equating your bones with your teeth. But I mean, look at your teeth; they're bones. So, let's be clear here. You need to have strong teeth. You have to focus on building bones, and to building bones, you need a nutritious diet. You need a high fat diet, not a low fat diet. You need your minerals and supplements, and and your vitamin D, your exposure to the sun, healthy calcium, etc. So that said, let's move on to our daily habits that you can do every day to improve your teeth. The first is get rid of fluoride, and I almost hesitate to bring that up because if you haven't already figured out that fluoride is poisonous, leads to neurological problems, dementia, and should have never been in our toothpaste or our water, you're probably at the wrong place. So, because that's pretty much a non It's not even discussed matter anymore. In my world, there are states and countries that have banned fluoride. There's other countries that have come up with their research to determine that fluoride was harmful for the human body. And of course, we know the history of how fluoride came as a waste product to processing aluminum. So first step is just forget your toothpaste. That's the first step, particularly if it has fluoride. Now you can go buy some healthy toothpaste without fluoride. I guess that would be the first step. But personally, tooth powders is what's been used all during time. Now, people used to brush their teeth with charcoal. People used to brush their teeth with salt. Remember, toothpaste has not been around that long. But here we sell this wonderful product here by remedies, which I really recommend. It is on the site. My famous tooth powder whitens your teeth and helps with removing plaque. If I could get that baby to focus there. Okay. Well, let's see here. Yes. Stabilize it here. All right, there we go. Whitens teeth, removes plaque, and it reduces. It's good for the gums too, and reduces oral inflammation. But let's look at this. Clay, it doesn't have that much clay. Too much clay will be too abrasive on your teeth. So a little bit of clay is good. I think there's only about 20% in there. But people have traditionally brushed their teeth with clay, but you have to be very gentle with your brush. I didn't bring my natural toothbrush here with me. Triphala, that's Ayurveda. That's an Ayurvedic herb, 3 herbs, Amlaki, Bibataki, Aditaki. They're good for cleansing. They're fruits, actually. It means 3 fruits. And then cinnamon and neem. That's a very traditional formula right there. Triphala, cinnamon, and neem, and licorice. And there's another herb here that I put in later called kadir. And kadir is for the gums. So I added that to this formula. This is probably like the 3rd or 4th version of this formula. And I'm very happy with it now. Of course, I've been using it myself. And then there's licorice and there's fennel. And the last ingredient is cardamom. And I added that cardamom. There we go. I added that cardamom much later. At first, it didn't have cardamom, but I just added it for the flavor. And now I love it. And everybody I give it to. Oh, there's a little black salt in there too. Little black salt. Wonderful product. And it's now on our website, Hermantes. So you can get that right on the Hermantes. I think it's only like $12. And it lasts an incredibly long period of time. I mean, it'll last you a few months. So brushing with a powder, and there's other people that make tooth powders besides me. It's just that's the one I make. And I did change it many times. That's probably your first step. Get away from the toothpaste. Go for the powder. Next is do some oil pulling every day, which is also Ayurveda. Now here's one called, daily swish, that I happen to have. But you can just use sesame oil. Mostly I've just used sesame oil most of my life. But this one's kind of nice. It's got cinnamon in it, and it's for your teeth and your gums, as it says. This is very nice. So you brush your teeth, and then you do the daily swish. And I forgot my Ayurvedic mouthwash. I know I didn't bring it. If I had somebody here to go run into my bathroom and get it, I would. But those are my 3 steps. I brush my teeth. Then I got this Ayurvedic mouthwash. It says Ayurveda on it. And you can find some online. It's not with alcohol or anything. It's also with herbs. And so then I do the swish, swish, swish with that. And then last, I do the oil pulling, which you have to leave in your mouth for a few minutes, move it around. So usually I leave it in my mouth for a few minutes while I'm getting dressed or doing something else. And then on a weekly basis, water pick is very good. Water pick gets in the little cracks and little holes, and also some other tools. And I do still have some pits and holes in my teeth. So this periodontal stick is very handy. You just change the tip with a toothpick. And I have these little toothpicks here with tea tree oil on them. These are very nice. They already, and that's the same company, Irumer, who makes the Ayurvedic mouthwash. So you can go look up that company. I like their soap, their mouthwash, and they do have a um, toothpaste. This is a very, very good company. But Neem is on that one. Neem picks. So that's very good to clean between your teeth. So I'll do that like once a week, clean between my teeth and get any holes with the periodontal stick, which I'm using the neem toothpick on here, and I'm getting in that little holes. And sometimes you need this little tool here just to see what's going on in there and look around. Of course, for my son, I had to use that to see what was bothering him. And now I have filled fillings with beeswax um, before, and it does help to take away the pain by keeping the oxygen away from it and allowing it to heal. But the real secret is, and dentists can concur with this, that the real problem with cavities or holes or cracks in your teeth is not the hole, because I have a couple holes in a couple of my teeth and they've been there a long time and they're absolutely no problem at all, as long as they don't get infected. And most reason they're getting infected is little pieces of food and things are getting stuck in there. So that's why you need the periodontal stick to get in the holes. You need the you need the water pick to get in the holes, and then you need the ozone if in case it does get infected. But I've found that just using my tooth powder every day and cleaning in there with my periodontal stick is enough. But what I mostly sell to my clients who already mentioned that they have pain is this formula here. And this is a very special formula, oral infection fighting powder. And this is what I made decades ago to stop the infection and stop the sores. And this will get rid of infections, abscess, toothaches, bleeding gums, inflamed gums. And you can see the ingredients there. We do have, it's got turmeric, and people that brush their teeth with turmeric, and charcoal, which is extremely alkalining and detoxing, and really helps with the pain. There's a little clay in there, benedite clay, neem, which is, of course, fighting the infection, kadir, which was in the other formula for the gums, and then cinnamon and licorice, and a little clove and salt. Very, very effective. Now we don't see the Herbman sticker on here, so this means this is not up on Herbman's site, but I will try to get this up on the website next week, oral infection fighting powder. So that's what I mostly give my patients, because by the time they come to me, they've got the inflammation in their gums. And I've had a couple people who are planning to go do gum surgery. And of course, I gave them anti-inflammatory herbs. I gave them anti-inflammatory diet. I gave this oral, infection fighting powder. And I told them to do oil pulling and all of this advice. And many people have avoided or been able to avoid the entire gum surgery. So, and that has something I've been able to do multiple times with people by giving out that particular powder. And I know I have even staff and clients who bought this from me like years and years ago and are still using it every once in a while whenever they feel tooth pain. I've had people come to my clinic and had tooth pain and were planning to go see a dentist in the next couple of days. I gave them this and they never went to the dentist. I made them 2 years later and they were still brushing with it. No pain, no infection, and the tooth remained in the same condition. So stopping the infection I've got that down. With that formula, the oil pooling, and the ozone, you won't get any infection if you have all of this and you're prepared to use them. Now, regrowing and regenerating the teeth. Now, that's a whole nother subject. And it goes back to nutrition. I have a few books here. I'm not going to totally vouch for them, but this one's good. Confessions of a Holistic Dentist, A New Era of Wellness. I've read that one before, Confessions of a Holistic Dentist. It's pretty good. The last chapter really is where it's at. And this one here, this guy, he's really good. Um, Cure tooth decay. And, all these guys are talking about ozone. They're really into ozone because ozone is used in Europe. There's ozone dentist in Europe. And I did know one ozone dentist in Southern California, but I don't think she's around anymore. And there's another book called Drill, Fill, and Bill. And that is explaining how the dentists make money drilling, filling, and billing. So my basic philosophy is don't let anybody drill in my teeth, mess with my teeth. I would rather use these methods here to keep the infection away and prevent infection, etc. And of course, like I said, I've kind of learned through trial and error in my own life by not going to the dentist for 45 years or so. And I had to learn the hard way, but I feel at this stage I've gotten quite good at it, particularly the inflammation and the gingivitis. I'm very good at. Now, my son, he never had a dental appointment. He never had his wisdom teeth taken out. He only spoke to me recently and told me that he realizes he still has all of his wisdom teeth and all of his friends had them pulled out. And he has no pain, no discomfort, and no problems from still having his wisdom teeth. So I was basically a minimalist. I still am. I try to avoid anything evasive, anything harmful, as the naturopathic code is, do no harm. So I definitely was not into pulling out teeth unnecessarily. And even when he did have a cavity, instead of drilling it out and doing this evasive root canal, which damages your roots at a deep level, and hits your nervous system and causes other health problems, I just had the dentist in India, because Indian dentists are a lot more flexible and than here in the West. And they would just clean it out and feel it with no drilling at all. And he did that. And it worked. One of them came out after a few years and we had to refill it again. But the main goal was to avoid the drilling. And of course, I need not say, avoid the mercury. We all know now that the mercury is toxic. We all know now that the fluoride is toxic. We're all past that. What we're talking about today is how to take care of your teeth on your own without having to go to the dentist. So I hope that helped inspire you. I would recommend everybody to have an ozone machine. I'd recommend everybody to have a water pick. I'd recommend everybody to start doing oil pulling, and there are different types of oil pulling. You can just use sesame oil, not coconut oil. Coconut oil is not traditionally used for oil pulling unless there's an infection or burning or gingivitis where you want something cooling. But sesame oil is building bones. Sesame seed is building bones. So usually we increase the milk, the dairy, and sesame seeds. These are some of the traditional substances used for make your bones stronger. So make your bones stronger, take proper supplementation without taking a bunch of synthetic vitamins like D3, and be preventive. Get a tooth powder instead of a tooth paste. And I have a natural toothbrush. It didn't make it. It's got like the natural fibers on it made from bamboo. But, I'm that kind of guy. Just everything, only cotton clothes, I don't like any polyester at all. And I have a natural toothbrush also made of bamboo fibers. It doesn't last so long. I have to replace it every, once or twice a year because it's kind of soft. But I don't want to brush my teeth with plastic. I don't want to wear plastic on my body. I don't want to drink out of a plastic water bottle. I'm just that kind of person, just trying to be preventive. Of course, this type of so-called radical thinking, I think, is paying off because, now we know that these plastics all have not just toxins, but estrogen, phytoestrogens in there that can affect our health. So only drink out of glass or ceramic cups. And there we go. Herbman Teas, our sponsors. Thank you very much, Herbman Teas, for sponsoring. You can go to their site, herbmanteas.com, and you can buy that tooth powder. And if you wait a week, I'll have my staff put up that oral infection powder later in the week on herbmanteas.com. But I really highly recommend the tooth powder. I may go put it on sale, and you can go use the coupon code podcast10, and you'll get another 10% off. I think it's already 5% off. I'll go increase it to at least 10% off, and then use the discount code podcast10, and you'll get another 10% off. 20. I think it's like $10 or $12 up there right now. So highly recommended a good tooth powder. Highly recommended do oil pulling, ozone every once in a while, and definitely water picking once a week. And so I hope that helps you. Hope that inspires you. Hope that motivates you to not have to run off to the dentist every time you feel a little problem, and you start to become more self-sufficient, which is really one of my overall goals here, is not to be dependent on other people. That was one of my early motivating factors for being an herbalist and natural health care and even natural dental care. So I could learn to take care of myself, take care of my own family without having to run off and pay somebody else and be at the mercy of somebody else, and possibly have adverse side effects by not understanding the best approach to dental care. Anyway, thank you very much, ladies and gentlemen. I hope this inspired you, and I hope you all have a healthy, strong teeth for the rest of your life. God bless you all.